And good afternoon. It is time for our regular Friday Lunch and Learn. And today we're going to talk about pelvic floor muscles. Now, I did some study on this not too long ago, and I was absolutely amazed. I mean, I knew that your hip muscles, your gluteus maximus, as we used to call it, is your largest muscle group. But I had absolutely no idea of the intricacies of the pelvic floor muscles. And so I want to talk about this because my mom and I had a laugh about this probably 10, maybe 15 years ago. They were doing commercials for Depends, and it was like, Mom, like, do you have to wear Depends? And it was like, well, no. And it's like, oh, okay, like, is this something that we have to look forward to? Because of course, looking at the television and the ads and all that, you think that when you get to be a certain age, that you're going to have to wear Depends. And so this is something. This is not a life goal. I'm just going to throw that out there. This is not a life goal for me, and I'm sure it's not a life goal for you. But I came across this article. This was written in the Epic Times, which I absolutely love. So if you want to have news that doesn't have any kind of spin factor on it, then you might want to look at this. But it's talking about using your hips to avoid incontinence. And I had, never really kind of thought about that. And so I thought that I would look at this and just see what it says. And I did not know this statistic, and you may not know this statistic either, but people, men and women over the age of 65 who still live at home, more than 50% of women and more than 25% of men report urinary incontinence. Now, I remember being a much younger woman and going out with people and all that kind of stuff. And people would jump and yell and yay and all this. And my girlfriend, my age, and we were in our 30s at the time, and she says, I can't jump. I said, why? She said, because if I jump, I'll pee. And it's like, what? I said, you didn't do your Kegel exercises. And she would laugh and say, yes, she did. So if you don't know, and men, you probably won't know if you're watching this, but ladies, if you're watching this, you know that when you had babies, the doctor, the midwife, the nurse, whoever would come and tell you, you need to do your Kegel exercises. So Kegel exercises is one of the easiest ways to explain it is when you're in the bathroom, you're urinating, you stop urinating in mid-flow. Those are basic strengthening the sphincter muscles. Now, your ureter is the long tube that goes from your bladder to the outside of your body. And it's probably ureter for your kidney to your bladder, urethra from the bladder to the outside of your body, right? So it's got an internal sphincter that you don't have any control over, but it's got an external sphincter, and you release that when you are in the bathroom and you need to empty your bladder. You release that on purpose. Incontinence is when you don't have a choice. You just can't control that muscle. And so we think about it as a rubber band. The sphincter is an elastic opening in your body. You've got them all over your body. You've got in your stomach, you've got one that closes to not let food into your stomach. But when you're eating, it opens, lets the food in. Your food stays in your tummy, in your stomach. And then when the food is digested, you've got a sphincter at the other end of the stomach that opens to let food pass through into the small intestine. So we've got sphincter muscles all throughout our body. And so the ureter, we want to make sure that I guess I said that again wrong. The urethra, we want to make sure that rubber band stays tight so we don't have that urinary incontinence. The doctors have told us for years that if you did your Kegel exercises, you're going to be good. But I'm reading this report, and it says that we need to do more than just the Kegel exercises. So I want to kind of go over this with you, and I want you to be able to have what you need here. Okay. Incontinence ultimately affects the need of care for family members and can be a challenge to provide proper skin hygiene. So this puts your caregivers, hopefully, I'm going to be 65 next year. So this kind of pertains to me as far as the age group. but I don't want to have to rely on somebody else to have to help me in this area. I'm just going to throw that out there. That's just not one of my life goals. So if I can learn to do something now to prevent that, and you guys can do something now to prevent that, then it's going to be better for all of us. All right. Is incontinence really a rite of passage as you age? Can you not go below ground, being buried, okay, without having experienced the embarrassment of leaking when you cough? Since we all want to avoid the need for disposable underwear, it is critical to gain understanding of the true pelvic floor function to address this issue. Now, I just want to tell you, you can go to YouTube and just type in pelvic floor exercises, and there is a really beautiful young lady, and I can't remember what it is, but I've looked at it. She will have a model, and she will show you the model and all the different muscles that are inside your pelvic floor. And those muscles keep everything inside of you, which is where we want it to be, right? But you can actually strengthen those pelvic floor muscles with some different exercises that she will show you. Some involve a tennis ball, some involve just laying on the floor and moving your legs certain ways and different things. So it's really worthwhile. She's not bad to look at, and it's not gross or anything like that. So I really want you to do that. So Kegel exercises focus on strengthening the urethral sphincter muscles. The urethra, as we talked about, has an internal and external sphincter whereby the urine exits the body. The internal sphincter is involuntary, which means you can't do anything about that. It's the external sphincter that we want to control. And Kegel exercises can improve conscious control and strengthen the ability to close off the sphincter. However, your pelvic floor is more than just the sphincter muscles, all right? A healthy pelvic floor is designed to successfully support the organs positioned above it. So it would be the bladder and the prostate for men. It is the uterus and the bowel and the bladder for women, all right? A healthy pelvic floor will support a full, heavy bladder without leaking, even when there is no bathroom in sight. And so if you are finding that you're having less control over your bladder, then this is really, really for you, all right? The main reason that the Kegel exercises fall short to fully restore the strength to the pelvic floor is because you cannot think about squeezing your pelvic floor muscles, all right? You have to do that through exercise, all right? It is designed to work. Your pelvic floor is designed to work subconsciously without thinking about it. So the bottom line is you can consciously squeeze your external sphincter till the cows come home. But if your internal muscles get slack, right, get loose, get fatigued, for lack of a better word, then they're not going to be strong enough to support your bladder. If your bladder's not supported, if it prolapses, and you may have even had to go in and have surgery to resuspend the bladder, resuspend the uterus. A lot of women have. The more babies you have, the more likely it is that you've had to do that. So how do your hips work? All right. And I'm just thinking, I'm thinking belly dancers, right? I'm thinking, people that move and run and all that kind of stuff, which as you get older, you don't do it. And people think that, well, we're older, we don't need to do it, but oh my gosh, we need to do it. So we've got to get our hip action going a little bit. All right. So the report goes on, it says being sedentary, so we sit a lot, being sedentary is directly related to increased prevalence of incontinence because sitting on our backsides for hours will weaken our hips and ultimately our pelvic floor. This is the main reason for wheelchair-bound people having incontinence. A person can have incontinence because of nerve damage, trauma, any kind of thing like that. But mainly it's because of inactivity. It's because of non-use. So the article goes on and it says, look at the pelvic floor, look at what you can do with that, and you'll see that it's more than just doing your Kegel exercises. So the best exercises to help you with your pelvic floor, all right, the best ones are to work hip rotation. So again, I'm thinking about belly dancing, right? And I know you don't have to go somewhere and learn that, but if you just stand in front of the mirror and rotate your hips, you are going to be strengthening your pelvic floor. And all of us can do that. I know if you lay down flat and you pelvic floor. Somebody's trying to call me. I'm sorry about that. I know it breaks up the response, so I apologize. So you want to be able to lay down on the floor and raise your bottom. And when you do that, you are rotating your hips, you're flexing your hips, and that's going to strengthen that pelvic floor muscle. All of us can do that. I can do that. You can do that. Your weight, right, can be your own body. So if you're lifting, if you're rotating your pelvis, then you are actually working to strengthen those muscles. All right. When doing the right training for these muscles, improvements are seen within just a few weeks. So if you are suffering incontinence, and if you're already on the depends side of the table, you can do these exercises and you can see results within a few weeks. And that is really, really encouraging. All right. The pelvic floor is an important part of your pelvic core. Sports performance is also enhanced with this kind of focused training. It's a good idea to seek out an expert, but like I say, you can do the YouTube videos and you can work with that. All right. Restoring optimal strength to the pelvic floor is necessary to resolve pelvic floor issues. This cannot be done just with your Kegel exercises, and these human movement truths, when followed, provide authentic function. All right, so this is natural, right? We don't lay on the table as many are taught to do with Kegel exercises when we live in real life. We walk, we run, we climb stairs, we get in and out of cars, etc. I never learned to do Kegel exercises when I was lying down. I learned to do them standing up. They would tell us when you're in line at the grocery store, tense up all those little muscles down there. And you could do it when you're driving. You can do it when you're standing. You can do it when you're sitting. I've never done it lying down. I'm just saying that. Never done that. It complies with gravity and ground resistance forces, the forces that work similar to healthy exercise. So when you're doing healthy exercise, I know a lot of older people, they will go to a treadmill, or they will go to a gym, or they will go to a mall and they will walk, and that's good. You need to do that, but you don't want to be shuffling your feet. You want to get those knees up. You want to just really work that body, because when you do that, you're strengthening those pelvic floor muscles. Leveraging mass works those muscles. So picking up things that are heavy, and I'm not talking about picking up things that are like heavy duty, but just picking up things that cause a little bit of strain. It contracts those muscles in your pelvic floor. And when you do that, you strengthen those muscles so you cannot have incontinent issues. These exercises will train the body on 3 different planes. We move forward, we move back, we move side to side, we turn right to left. So you've got to do all 3 planes. So when we walk, we do that. We walk forward, we walk backward, we walk side to side, we turn and look. And those are things that are those are the 3 planes. You need to do that. Everybody can do that. Even if you're not fully mobile, you can do that. You just have to put it in your planner, put it on your calendar, and be mindful that if I don't want to be depending on adult diapers, I need to be doing this. Walking upstairs is awesome, okay, because you're working that pelvic floor there. All right. These exercises elicit a reaction. Muscle reaction to motion is more important than creating the said motion. So when you look at these videos, I'll try and find one and pop it in the comments. Now, when we do this on Facebook Live and that kind of thing. And so even though it's streamed other places, the comments don't always come out on other places. And we try and get back to it, but we're busy and it doesn't always happen. And I apologize for that. But I promise you, you can go to YouTube and you can do pelvic floor exercises in the search bar, and you will find tons of them, and they're very easy. You can do it. You lay down on the floor and you can do things. You sit in a chair, you can do things, but just walking, running, jumping. I know you can't jump if you don't have bladder control, but we're going to fix that in just a few easy weeks. Okay. These exercises will facilitate joint proprioceptors. Now, that's a big word, okay? The proprioceptors tell the brain how your body is moving. Moving more body parts enhance this, while sitting and standing still inhibits this. So we want to be moving. You use it or lose it really works with this right here. So your proprioceptors, okay, are concentrated in your joints. So if you're not moving your joints, you're going to be missing out on this. These exercises will create subconscious reactions, and that's what you want. Muscles need to be able to react properly without the need for conscious thought. It promotes transformation versus stagnation, and none of us want to be stagnant, okay? Muscles must adapt specifically to the opposed demands. So when you put a demand on your muscles, then your muscles comply with you. Your muscles do what you need them to do. And when they do that, then you don't have to think about it, and everything goes right back to your younger self. And that's what we want. All right. These muscle exercises enable mobility and stability. Muscles must provide both strength and control of motion. And so if you are feeling weak, you feel like you can't do anything, I'm just here to tell you that this report says that if you will start movement of any kind, your body will respond and you will get stronger. Now, I have never run a marathon. I'm not a runner. I'm just going to throw that out there. I've tried. It hurts too much. I'm not going to do that. But I can ride my bike forever, right? And that uses muscles. I can walk. I can squat, I can lunge, I can do all those kind of things. And all of those kind of things will strengthen that pelvic floor muscle group. And as we strengthen that pelvic floor muscle group, then we're going to strengthen the control that we have over our bladder. And we're not going to have to wear the adult diapers, okay? When you do these exercises, it provides success, internal locus of control, and relevance. Achieving steady progress, gaining control of the issue, and knowing that the work being done is relevant to the problems that, take the joy away from you. And so we want to do that, okay? Kegel exercises omit these truths from the equation. The question to ask is, why can't the muscles in the pelvic floor activate as needed? What is inhibiting that function? It is imperative to ensure your whole body is functioning well in all three planes of motion, so you will not have any unpleasant surprises as you age. Now, this is one thing that people come in all the time and they just accept that because we're getting older, we're going to have issues. And I'm just not on that. I'm not on that page with them, right? I don't want to get older and have issues. I don't want to get older and need adult diapers. I don't want to get older and need somebody to lead me around because I can't see. I don't want to get older and be demented. I don't want to have all those things. And so I do a lot so that we can maybe avoid that, right? And you can too. It's not a bygone conclusion that you have to have these issues. You absolutely do not. But you have to be proactive in order not to have that. So remember, we want to do the three planes of motion: front and back, up and down, side to side. Okay. You want to be able to do that. So walking, climbing stairs, twisting, all of those kind of things will work to improve the strength of those pelvic floor muscles. I remember some of them, you lay down on the floor, you take your one leg and you raise your other knee up and you put the other leg over your knee and you twist. So that's up and down, side to side, front to back. So you can do that. That's all 3 planes of motion that you can do. And so this is not a lost cause. So the article goes on to say that if you understand that incontinence is not necessarily age related, but it's function related, that means we've gotten lazy and we've not moved our bodies because we're old and we feel like we don't have to, which I hear a lot of people say that. I don't want to do that because I'm old. Well, if you don't move, guess what? You're going to have some issues. And so we don't want to have those issues. I don't want you to have those issues. This article was written by a Colleen, I'm going to mess this up, but Kopsifis, who is the founder of HaveLifelongWellness.com. You can look at that. You can look at that website. And she's all about physical therapy and nutrition to keep everything going the way it needs to. Now, there are herbs and supplements that we have that you can get in your good health food stores, your good doctor's offices that go in to the muscles, go into the sphincters and re-innervate them. Okay, if something is not innervated, it's gone slack, it's gone weak, it's gone floppy. All right, no one wants to be floppy, right? But if you don't use it, you get floppy. So we do have herbs, there are supplements, there are exercises that we can do to get out of the floppy stage. And so this is what I really want you to think about. I want you, if you have problems, I want you definitely to look at those YouTube videos. And like I said, I don't have a special one that I like more than any other. I've watched several of them and they all pretty much say the same thing. The main thing is you've got to move your body on 3 different planes in order for you to either reserve the function, keep what you have, or to regain the function if you have lost it. So if you are a couch potato, and I'm saying this lovingly, if you are a couch potato, you're going to find that your pelvic floor muscles are going to fail you and you're going to have leaks. We don't want to do that. We want you to be exercising, of course, moderate, not overly strenuous. All right. Do what your body can do, and your body will love you for it, and your body will recover. All right. So it is the weekend. Go out, enjoy yourself, take care of yourself, do a lot of self-care. Know that we love you here, and we will talk to you next week. Take care.